Mastectomies and radiation can cause severe scar tissue or adhesions that limit shoulder mobility and causes pain. No matter how skilled your surgeon is and how compassionate your surgeon is, anytime you have surgery, even if it's necessary surgery, there's going to be scar tissue. So after a mastectomy, obviously there's scar tissue, and especially if it's a more extensive mastectomy or there's lymph nodes that have to be taken out. And then radiation also causes tissue damage, even if it's necessary. So what does adhesions feel like? What does scar tissue feel like? What does radiation fibrosis feel like? Sometimes we have people that come in and they complain of this thickening, this thick, really tough mobility of the tissue. And sometimes that's just that radiation that comes in and makes that tissue really firm and not mobile. Sometimes people come in and they're complaining that they just can't get that arm range that they have, that they need, or that they formerly had. Other people talk about almost like a nerve entrapment pain where it's shooting either down into their chest or down into the arm. It's different than this neck pain that shoots down into the fingers. It's more shooting into this chest wall, down into the arm. Anytime I move, it could even be into the back, but it's like this nerve entrapment feeling, and because of the scar tissue. And sometimes it's just this hard, can't quite get my shoulder to where it used to be. So I'm going to show you a couple of stretches. So the first thing you can do is you hold onto your cane and you wrap a weight around here. If you want to, you could do it without weight. Remember to talk to your medical professional. I'm going to raise up this arm, and this is the arm that's going to have limited range. We're going to go ahead and take the arm that could help, and we're actually just going to really kind of move the arm that has a hard time moving into the position we want. And when it's there, we're just going to relax. Take a big deep breath in. And then as we relax, we're going to push into more range. And you can hold this for a couple of minutes, just relaxing. Don't push hard. It's more of a relaxation. Every time I breathe in deeply, I can feel the resistance. And then as I relax, I can just push into more range. Once I'm getting pretty flat but still want a stretch, I can actually add some lower trunk rotations to continue stretching. So that's one way of stretching that shoulder. The next way, sometimes it's hard after surgeries, after radiation, to wash your hair, to put on a shirt, to comb your hair, and it's this motion, this external rotation. So what you do is you hold on to your cane, come into a 90-90 angle here, and I gently, with my hand that feels like it has more range, I gently push into the range that I need. Holding at the range, at end range, taking a deep breath in, and adding just a little push towards the end as I exhale. Do that again, breathe in, add a little push as I exhale. A lot of women lose this internal rotation range, and that's really hard when you're trying to buckle a bra, pull up your pants. So hold on to the bottom of your stick, and you can start at 90-90, right? Shoulders at 90, elbows at 90. And I'm taking my hand that has some mobility, and I'm moving myself into internal rotation. And again, when I stop, I just hold it there, take my big deep breath in, and then push. And each one of these, again, just do for a couple of minutes. Another stretch you can do on the go is a door frame stretch. And again, arm at 90-90, and we just want to stretch this out. I'm walking through the door, I'm going to grab onto the door and just stretch. As you can see, this whole front section of my shoulder is starting to stretch. Another one I like is reaching up to the top of the door frame and bending my knees. And that's helping extend that arm even more into flexion, basically. And remember, any stretch shouldn't be painful. You want to stretch to the range where you feel a stretch, and once you do that, you breathe into that range, feel it stretch a little bit more, and then as you relax, as you exhale, you relax into more range. If you're having problems with mastectomy pain and scar tissue and radiation pain, we encourage you to seek treatment for this adhesion-related pain, and if it continues, make sure you call us at Clear Passage.